Let's talk about gestational diabetes. Gestational diabetes is a word, a term used to describe diabetes in pregnant women. So if a pregnant woman is having diabetes, then we'll call it gestational diabetes. So if they are pregnant, then if you monitor their blood sugar level, you will notice that the normal level should be around, the fasting blood sugar level should be around 80 to 100, whereby after eating in a normal level, it should be, the sugar level should be around 170 to 200, whereas 2 hours or 3 hours after eating, it's going to drop down because it will now be 120 to 140. You understand? Because it's going to, the level of the sugar is going to drop down. But in an impaired glucose level, you will notice 101 to 225, 225. Or in the after eating, you will notice 190 to 230. Then 2 hours after eating, then you'll notice that it's going to drop down to 140 to 160. That means it's impaired. Now, in a diabetic, in a very serious condition, which is the red one, then you notice that the sugar level is 126 plus. Notice it is 220 to 300. So after 2 hours from eating, it will drop down to 200 plus. Then you know that your diabetes is so high. So what do you need to know if you're having gestational diabetes? You need to know the symptoms of gestational diabetes. So the normal symptoms of diabetes will be showing, because it's just diabetes, but the difference is that you're diabetic when you're pregnant is different from other normal diabetes, like diabetes type 2, diabetes type 1, but this one is you're diabetic when you're pregnant. That is just the difference. Gestational, that is how it derives its name. So what you notice, you'll be noticing that you'll be having more frequent urination. You'll be having feelings to eat more. You'll be having more hunger. You'll be having excessive thirst, and at the same time you'll be having fatigue, and you'll be having yeast infection. You'll be producing more yeast infection. So the treatment and the management, which if you go to any doctor, they will recommend some medications. I won't be telling you any medications here. All right, so that is one thing I will not be telling you here. So, but the other things they'll ask you to do is to change your diet. All right, stop eating something so sugary. Try to eat more vegetables and some other stuff. Advice they will be giving to you, and they will advise you exercise. Now I can tell you exercise. If you want exercise, I'll be making a video for that in my next video on how you can manage gestational diabetes with simple exercise. Thank you for watching. Have a very nice day.